Alright, Aidan, Carey, this is my infant medical assessment. Myself and my partner are called to the home of a 3-month-old with difficulty breathing. The patient is found to be in her mother's arms, slightly lethargic, and as I enter the room I hear a wheezing without auscultation. The mother states she has been dusting and the baby started to cough. She called when she started to make weird noises. The baby seemed to fall asleep, becoming harder and harder to wake up. Before arriving on scene, I'm going to determine that my PPE is going to be gloves, equipment. I'm going to bring a pediatric bag, jump bag, and oxygen. I'm going to consider C-spine, and I'm going to consider that the scene is safe if dispatch tells me. As I arrive on scene, I'm going to ask the mother to hand me the baby politely. Upon primary assessment, I find that the baby is responsive to pain. The airway is patent, respirations are 26. With wheezing in all lung fields, heart rate, I'm going to take and find 126 at the brachial. Strong and regular pulse. I'm also going to take blood pressure via brachial. OPQRST, quality of respiration is fast, shallow, with above noted sounds. Mom states the problem has been going on for about an hour and has been progressively getting worse. As I care for the patient, my partner is going to take a sample history from the mother. And his sample history is the baby is lethargic, no known allergies. Baby has been evaluated for possible asthma by her pediatrician, and the baby's last oral intake was nursed 2 hours ago by the mother, and the mother was cleaning with the baby when the room filled with dust and the baby started having difficulty breathing. The baby also has a non-productive cough, and our interventions are going to be for this patient that we're going to contact medical control for advice if we want to give the patient albuterol. Since it is an infant, we would want to contact medical control. And due to the respirations, we're going to BVM the patient at 15 liters per minute. And I'm going to take a secondary assessment which finds that cardiovascular hasn't changed. Respirations are now 28, and lung sounds are still wheezing. The baby is of good weight, clean and well cared for, and is responsive to palpation. So my transport decision for this is I'm going to rapidly transport and reassess every 5 minutes due to the fact that the baby is still lethargic and respirations have gone up since the primary assessment. As I arrive to the hospital, my missed report is I have an infant approximately 3 months old. The chief complaint is difficulty breathing with possible asthma attack due to dust. Patient has no known allergies, no known medications, no known past medical history. Interventions are BVM at 15 liters per minute with possible albuterol depending on what medical control says. I'm also going to tell them the vital signs, which are respirations are 28, lung sounds are wheezing.